Myself first. We've got a few online students joining us today, and we are also recording this session so that our external students have got easy access to the session. Thank you so much, everyone, for coming. I'm Tasfia. I'm the industry consultant at the CDU Career Center. Before we begin, I would like to acknowledge the Larakia people, traditional custodian of the land on which we gather today, and pay my respect to the elders, past and present. I also extend my respect to the Aboriginal and Torres Strait Islander people present here today. It's on my notes. I have to make sure that it is recording. Yes, it is. And a little bit of housekeeping. I'm sure you know the venue more than me because it's your classroom area. So for any emergency, we'll use the back doors and go left from the venue, or just follow us. And for the toilets, it's on the right-hand side of the venue. And I will be taking some photos. So if you don't want to be included any of the photos, please let me know, because some of our photos are go into the social media platforms. A quick one about the Insights to Industry programs that we run. These programs are run for the students and graduates so that we can equip them with all the insights about the industry and various opportunities in the workforce so that you can secure a role in the industry and make yourself workforce ready. So I think without further delay, I would request our guest speaker from NT Health, Michelle, to start her presentation. Michelle, over to you.
Can everyone see that? No. Hello, everybody. Can you hear me okay? Super, thank you. Okay, and just to follow on from Tasvia, to acknowledge the traditional owners of our land today. We're here in Larrakia, and you'll see by the icons on the screen, that's to represent NT Health. We're across all 5 regions of the NT. And I'd like to acknowledge all the First Nations people present here today and pay my respects to elders past, present and emerging. So I'm Michelle Dunham, and I work for the Office of the Chief Nursing Midwifery Office, who is an officer who's a professional lead for nurses and midwives across the NT. And a part of our team today, we've got Simona Thomas, who works in our team as well, and Naomi Chapman, who's the Senior Director for Nursing Midwifery Strategic Policy, and they both join us here today. So the NT Health is a Department of Health for all of the Northern Territory. And it's made up of 5 regions comprising of 6 hospitals, including 2 in Darwin, 1 in Darwin and 1 in Palmerston, 1 in Alice Springs, 1 in Tennant Creek, 1 in Catherine and 1 in Nullumboy. And primary health care is provided in 74 primary health care centres, including clinics run by the Aboriginal Community Controlled Health Organisations, or ACCHOs. The NT population is quite small, with only 245,909, very specific. However, our population is really truly multicultural. You'll hear from me and we can see around the room. So our patient demographic is very wide-ranging, with over 200 languages spoken and a large proportion who identify as Aboriginal or First Nations. And we provide services from urban to very remote. So a career with NT Health, as with life in the NT, is anything but dull. And as you see from this slide, the NT provides a fascinating setting for your graduate year. So we're only 1% of Australia's population. However, we have some of the sickest people. The vastness and the remoteness and the diversity all make it such a great place to live and work and learn. And the NT graduate, oh, sorry. Yes, sorry. Yeah. So this one, yeah, please. In here. Mm-hmm. That one? Yep. No. Oh, super. All right. Yep. I don't know if I do that. Can you see it again? Is that working? Let's see. Yeah. Nothing like a bit of an IT problem to start the day off. So the NT Graduate Nursing Midwifery Programme provides opportunities across all of those 5 regions. And while each region and hospital offers really different experiences, each provide a really amazing opportunity for your graduate year. So the graduate programme. So applications are currently open for the 2026 programme, and it opened in late May and will close in February 2026, and that's to include those people who are finishing in summer semester. And this is very different to graduate programmes across Australia. So to be eligible to apply for the 2026 graduate nursing midwifery programme, you must have graduated or due to graduate between December 2023 and February 2026. Have working rights, so be an Australian citizen, a permanent resident, or hold a visa with non-employer sponsored work rights prior to commencement. And just to verify, you cannot seek sponsorship through the graduate programme. For those of you who are on a student visa 500, you can still apply. And when you get that letter of completion after you finish your studies, you can provide us with that, and that overrides that 20 hours per week minimum working rights, and you can actually begin the program then with full working rights. And you can't have any more than 6 months experience. So for those people who may, probably not in this room, but people who may have graduated last year, they can't have any more than 6 months working experience to apply. So it's very much for our new graduates. So the website, that's what the start of it looks like. There's quite a lot of information on it. It provides all the necessary information regarding the application requirements, the documents needed. And this year we've included the intakes per region, those key dates and timelines, the numbers that we take in each area. So I really encourage you to read it. And should you have any further questions, I really do encourage you to contact us directly. We'd much prefer you to ask us than maybe ask someone who's done it last year, the year before, and things might have changed. And I'd just like you to really, like I'd mentioned, pay special attention to those timelines and encourage you to apply as soon as you're ready, because that really does help you give you more options and choices, because you're more likely to be in those first lot of offers. How to prepare. So I would really strongly encourage you to be open to opportunities. And whether that's in the location of the programme or maybe a different clinical rotation than you had previously decided on. So often I talk to nurses and midwives who maybe didn't get their first clinical preference or took a chance and went to another regional hospital. And they all say they gained so much from that experience. All rotations and locations just offer such a wealth of experience and exposure that's really hard to find anywhere outside the NT. So like all us Territorians, just be open to adventure and opportunity. You'll see from the website that places are limited, so I encourage you to really put your best foot forward with your application. So just a brief overview of what's offered and where. So there's a small number of rotations that is offered in Gove District Hospital. So you'll have to actually nominate a preference of a larger hospital to do once part of your 6-month rotation, and then a request to go in for an opportunity to have a rotation through Gove, but it's very limited opportunity there. Catherine hospitals offer a unique opportunity to only 1 graduate midwife and 6 nurses across 2 intakes. Tennant Creek Hospital has 1 graduate midwife and 2 nurses across 2 intakes. Alice Springs has an opportunity for 5 graduate midwives, and then they do every 2 months, they take in intake of nurses. And then at Royal Darwin, there is 4 intakes a year with around 18 midwives across the year and around 200 nurses. And that might seem a lot, but across 4 intakes, it is quite competitive. So before you apply, I really suggest to read the website and then read it all again. Have all the requested documents. There's a checklist on the website. There's not that many, but really please make sure that you've uploaded everything that you need. It's an incomplete application otherwise. Make sure your cover letter addresses the job description, which can be found in the link to apply, and that addresses the essential criteria. And this is might be your first step into applying for a job with NT Health, and that's how you apply for a job. So really think of this as your first step in your profession. Make sure your references are appropriate and responsive. The website has a list of appropriate referees, and I highly recommend that you contact them via phone or email and ask them to be your referee. Remind them of the dates that they had you in placement, and it really goes a long, long way. They get inundated with requests, so if you're that person who's asked politely and give them the dates, it makes it easy for them. It really helps. I'm sure Zoe can attest to that. And an unresponsive referee really can delay your application. And your clinical placement reports, and that's your ANSAT reports. We want the final versions. We want that summative report, preferably 2 from third year. But if it's, or I know a lot of you guys are doing your master's, so that's your final year. But 1 first year and 1 final year, but preferably 2 final years. We really want to see where you're up to right now. And some key takeaways from a lot of questions that we get asked. So you don't need to be APRA registered when you apply. So you can apply before you receive your registration, but you must have your registration before you start work. Please, I'll reiterate, submit all requested documents. Us having to follow you up for your missing documents just holds everything up. And it's the fact that it's open ongoing, it's unnecessary to submit an incomplete application. And again, just be aware that this is the first step in your future career. So whether you're still completing a placement, you're applying for your grad year, or when you start your grad year, your professionalism, your patient care, and your willingness to learn and work as a team, it really goes a long way and it really does get recognised. So just a quick overview of what to expect. So the grad programme is a 12-month employment programme for nurses and midwives. There is shift work, which I'm sure you're well aware of, and it's offered on a full-time or part-time, and you can request part-time, but that's 0.8 at a minimum. You'll receive orientation and supernumerary shifts in each area that you go to, and there's online and in-person education as well as mandatory training that we all have to undertake as NT Health staff. And in terms of your rotation, I think the majority of you here today are nurses. So the nurse programme is a 12-month programme, and generally that looks like 2 6-month rotations in 2 different clinical areas. There are some critical care areas, ED, ICU, I believe renal as well, and a couple of other places that might be a full 12-month. And again, when you're submitting your application, you don't preference then. It's when you're offered your conditional letter of offer, we put you in touch with the grad team. That's where they talk to you about what's on offer. And you can submit preferences and they'll try to do their best. But sometimes a different opportunity comes up and could change your life. And then the midwifery programme, that's rotated through several different areas within the midwives. And again, the midwifery educators will support the midwifery grads through that. And then with your transition support, so these programs really are designed to shift you from student to professional. And that support is given by a myriad of people, obviously your educators, your grad educators, but your managers, your teams, your colleagues, and your fellow graduates as well. You're all in it together and everyone wants to do their best to wrap around and support you and get you ready for your next steps. Right. And this is just a little bit of an overview of upskilling and career pathways. And that's not just for your graduate program, but also ongoing with NT Health. So as part of the graduate program, you get career coaching, you get mentoring, you get some support in regards ongoing employment opportunities and assistance. But also ongoing with NT Health, there's lots of opportunities for further formal education, and that career coaching and mentoring is continuous throughout your career. And then with being an NT Health nurse or midwife. So some of these are just in relation to the grad program. So like I said, it is a 12-month employment. So you'll receive a 12-month contract. That's either 6 or 12-month rotations. Your starting salary is really good. And that's just a salary. Then there's plus penalties on top of that. So we get really good salary packaging options. There's attraction and retention allowance. And that's paid at 3 months, then at 12 months. And then if you stay on that further year, there's another part of that allowance as well. And that's all part of the enterprise agreement. And again, just a top tip, even we have nurses and midwives who work with us a long time who don't know our enterprise agreement, and it's for you and it's a really good thing. You don't have to read it all at once, but it's available on our intranet site. It's available on the internet as well. Just have a good read over it because it's really good to know what you're entitled to, because there is so much in terms of allowances, postgraduate profession development. There's so much. For any of you online who are from interstate, there is some relocation supports there available as well. And there is an on-site accommodation across all our hospitals as well. So not just here in Durham, but all the hospitals across NT have on-site accommodation available as well. And again, those 7 weeks annual leave, which is always a great perk of being in the NT. Or NT Health, sorry, not everyone gets it. So almost finished with you, but just, I suppose, why choose NT Health for your graduate year and beyond? And this is, again, I'm not too sure if you've seen this in your placements or anytime you've been with NT Health, but there's really is endless career opportunities across clinical areas, across regions, or different pathways, whether it be research, education, leadership. But it's also NT Health values, and they are safe, responsive, and kind. And we try to build that into all our decision making on all our interactions with our consumers, our colleagues, or anyone who comes across our doorway. And our values really underpin our activities, and they're supported in our vision and our commitment to working with the community to implement person-centred care. So kindness costs nothing and means everything, and a simple act of kindness are easy to perform and can have a profound and positive impact on others. And I suppose you're taking that into your placements already, and you'll take that into your grad year and with our teams and our colleagues. So I'll leave you with this. And these are just some QR codes. And again, we can share those links with Tasfi and the team as well. And one of them is just to our graduate nursing and midwifery homepage. That has, like I said, it's got everything there, that link to apply. That's the important bit, but make sure you have a read over it as well. And also, if any of you aren't already, we've got a nursing midwifery private Facebook group as well. I don't know if Facebook's still cool or not, but we have one. And we just post links as well, whether that be education opportunities that are coming up, sometimes we have competitions, when to go to conferences or different education packages, or just different opportunities that are coming up, and people can post there as well. But yeah, that's really all for me. Really look forward to receiving your applications and seeing you around the floors of the hospitals. But open to any questions or any feedback at all. Just, I'm here for a little while. Let me know. Any, yeah. No, so that always causes a little bit of confusion to people who are still studying. That is only for people who maybe qualified last year and might have went, say, to Brisbane and has worked for 8 months somewhere else and now are trying to come back to the NT. You guys should apply. If you're all finishing this year, you should apply now and then start the grad year next year. So that 6 months is only for people who may have already had experience working. So they're postgraduate and they may already have experience working. Does that make sense? Yeah. So this is so the graduate year is for you, but some people who didn't apply for a graduate program maybe last year are only applying this year. So it's making sure that they haven't worked for a period of time and now are starting a grad year. Does that make sense? Yeah. Is it? Can you hear me? Should I do that all again? Yeah. Yeah. So lots of things. So we with that mentorship, sorry, the mentorship and career guide. Can you hear me okay? Yeah, super. And that is something that's provided to you throughout that year. So with the educators, with your managers, you can start to talk to them throughout the year. What do you want to do? Are you really happy in that area that you're in, or is there something else that you'd like to do, a different area? So that's an ongoing conversation. And then throughout, and that's what I speak to about, putting that best foot forward, really making the most of that graduate year. That's going to really help you go, okay, I've done my grad year and now I can apply to either stay ongoing within that unit that I'm in, that I'm started to get embedded in, or actually I really want to try something else and then apply to work somewhere else in the NT. But that grad year is really about giving you, it's consolidating all those skills that you're learning now, and it's our systems, our people. It's all about embedding you in the system, and then that support will be there through that year to help you take that next step. Then, yeah, yeah, yeah. Do you have a final year placement done at all? Yeah. N- No, and you need to then wait until you have a final. You need at least one final year placement, but that's okay. That's why we keep it open ongoing, because there was this pressure to have everything in 3 weeks. So we want you to apply as soon as you're ready. So if you have no final year placements done, but you'll have a final year placement completed in October, apply then. Yeah. Yeah. But you can go into the website and have everything ready to go. And then as soon as that's done, you can submit. Yeah. 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 Hi. So it really depends. So at this stage, this is a 2026 program. So there is some people who are already registered, and there was a couple of pockets where we had some available places. So those people we prioritize because they're registered and ready to go. For you guys, you're not going to have registration yet, so it will be, and that's one of the key changes we've made this year, and it's all available on the website, and it shows if you apply up until say July, expect to get your offer early September. And again, if you're applying between, say, September and October, then you're probably going to get your offer in November. And it really clearly does that. That doesn't mean in terms of intake. So then we work with yourselves and the grad team to see what intakes work for you. Because someone who applied in July mightn't actually want to start until late next year. And that's why I say apply as soon as you're ready, because it just gives you more options down the line. Yeah. I'd apply now. Again, if you get it in as soon as you can. So if you're already registered, you're ready to work, and there's availability because there's only a few. Yeah, but definitely really encourage you to apply as soon as you can. And yeah, those people who are work ready and ready to go are more likely, and who apply early are going to be more likely to get those earlier intakes next year. Again, all depending on availability. Yeah. 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 What can you clarify that in terms of what placements are doing this year? Mm. Yeah. 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 So for the pre-reg masters, do you only do one major placement in your final year, or do you do two? Two. Have any of you done one already? Then second year. Yes. Yes. So you're in the masters as well, and you've okay, and you just have placements outstanding, or you've done some placements, or is there a mixture? Okay. Yeah. Okay. But did you do a semester one placement? Yes. So that's a final year placement. So you can use that. Yeah. So you can use, so preferably we'd love to see two final year placement, but if you've done one final year placement, submit that with your last placement for second year or first year. Sorry, it gets confusing with the masters. Yes. So that's okay. Yeah. So if you've already done a final year placement, you can use that. Yeah. Yeah. Is that, yeah? Yeah. Okay. Sorry, guys. I just when question answers, if you just want to wait till everyone's finished asking questions. No, so you get your offers. So there's a difference between offers and intakes. So if you put in your application, it's when you get your offer, but then it's depending what intakes are available. Yeah. 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 Because generally those earlier intakes are the ones that fill up first. Where do you sit with your placements? Yeah, but you've already got you got at least one final year placement already completed. You've no final year placements done at all. Yeah, that's okay. So as soon as you've done one, then you can apply. Yeah, that doesn't mean you won't get an early intake because I think it's February. Are you Darwin based? Yeah, so it would be February and April. And again, that February one is the most sought after one, but it may be April. Yeah. Yeah, you wouldn't get employed with NT Health until your grad year starts, but you could seek employment somewhere else, and that's fine. That won't eat into anything. If you did get a nursing job or anything, that won't affect your grad year. But yeah, yeah, no worries. Yeah, perfect. And just to provide that clarity, yeah, yeah, perfect. Anything else? Yes. Yeah. So the Ruson, you must, but you're a line manager as a Ruson and then a placement referee. But you must, and we've actually made a change this year. If you're employed by NT Health and Northern Territory Government in any capacity, we need a reference from your line manager. Yeah. And that's standard NTG practice. And that's what we're trying to, really show everyone. This is your employment that you're applying to. So it's total same as merit selection, referee checks, everything we would do if any other job you would be applying to, the same thing. So that's why it's really important to put that application in, meet what is requested from you, but your referees are the same. Yeah. Casual M. Simona, what have they been doing for the casuals? Yeah, who are they using there for the referees? Oh, perfect. Yeah. So what was that, sorry? Uh, Yes, if you're a casual. Yeah. Uh, if you're based on a specific ward, even as a casual, but you constantly, then I would just check with your line manager to say I'm casual, but I'm always here. Would you mind being we can see who are our managers and who's line managers. So if that's really appropriate, that's fine. Yeah. Hmm. Yes. Yeah. So you work to that scope and then it will be the next available. So what they will try to do is a route. And again, it depends. So this is not cut and dry. It will really depend. So get that application in as early as possible because we really want to identify you as a Rosan to see where you're at. And then the team at the hospital will help guide you with that. But yes, you're able to work to your scope as a Rosan until you start. And that's been a change. We're trying to get that written into procedure, but that will be written up and confirmed soon. Yeah. Yeah. Yes, no, no, no. And that's what used to happen. Yeah. And we made those changes because what we don't want, you're already in the system. We don't want to take you in and then pop you out again. So that's a change that's been made. Yeah. Sorry, you had a question? So if you're an NTG employee, we want two placement referees and then we want your current line manager as from NTG as well. Yeah. Anyone. Yeah. Yeah. So admin, education, anything at all. Yeah. 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 Cool. Yeah. Mm-hmm. You need, and that's what we're going to clarify, we need one final year placement before you apply. Yeah, at least one final year placement. Yeah, yeah, yeah. So just at least one final year placement. So whether that's a semester one or a semester two, but you need to have at least one. But we're going to get that clarified and make it really clear, especially for the masters or pre-reg. We'll get that information and we can work together to really clearly state when you need to apply for that then. Yeah, because it gets confusing every year. Yeah, yeah. Hmm. So you applied for last year for 2025? Yeah, yeah. No, this one, the 2026 only opened on the 26th of May. Yeah, there was one, not that even closed in, no, it's, don't know what you applied for. If you want to double check, yeah, yes, you check and yeah, then you can check with me and I'll check. Yeah, you could apply for an amazing job somewhere. Yeah. Uh, no. Yeah, yeah. So in terms of priorities, how does it work? So really what will, and so there's a few priority areas. So as with all NTG, there's special measures because we really, that's a part of our strategic plan is to bolster the number of Aboriginal and First Nations, any people, but definitely our nurses and midwives. So they are a priority area. And then after that, we really do try to prioritize our Northern Territory government and Northern Territory people. You guys are doing placements here, you're understanding it. What we will do this year, though, because we're doing the set offers, we will be doing bulk offers. And then when we have that back, the graduate teams will probably base that on scores as well. So it will be competitive, but it will be really dependent on a few different things. When you submit your application, submitting in a full, and then you're going to be the earlier you submit a full application and get that conditional offer, you're kind of prioritizing yourself for those intakes that you want. And some people just can't apply until later on. So if you're not applying to February, the likelihood you're going to have hundreds of people who've just come before you and may be prioritized above you. Does that make sense? Yeah. But definitely just get it in as soon as you're ready. Putting it in with missing documents is not going to help you. So really making sure you put it in full. Yeah. Per intake, yeah, and we've got all that on the website this year just to make it really clear because we understand that that can be really confusing as well. So it differs per hospital. For example, at RDH, there's four different intakes: February, April, August, and October. Yes, yeah, yeah, definitely. And they're set. And that's the thing. It's like anything else. There's a certain amount of numbers. We have to keep that the balance on the wards as well. You know, you need those senior people to then support you because then in a couple of years that will be you guys as senior people supporting it. So it's all about maintaining that balance. So the graduate teams work with a wider operational team to make sure how many can we take in each ward, how many can we support. So it is set. It's around approximately about 40 to 50 per intake at RDH each year. So yeah, and that kind of changes depending on everything else that's going on as well, but around 30, 40. Yeah. And that's just at RDH and that changes in different areas. Yep. Yep. Yeah, that's a really good question. So what happens? What happens is once we assess your application, and then this year we will put everyone who's already applied. So this first people, I think up until end of July, they'll all receive an offer in September. So everyone will get sent out, and what you get is a conditional offer for a location. So you've been offered a graduate nurse position at Darwin, a graduate midwifery position at Alice Springs. Then what happens is you got 5 days to respond to that. So you let us know, yep, I'm happy to do that. Sounds great. Then what we do then is we send all that information to the graduate team. We say all of these people have accepted. Here you go, grad team at RDH. Here you go, grad team at Alice Springs. Then the graduate team contacts you, and then that's when you get into the fun stuff. What preferences, what intakes, and they do an amazing job, and they'll give you out a welcome pack, and they'll give you preference areas. And a lot of times that might be in critical care or in surgical, and they'll do their very best to really support you in that area. But like I said, it is really competitive. So sometimes those areas that you think you might want doesn't work out. And sometimes that's a really good blessing. It steers you in a different pathway that you never thought of before. So it is only a grad year in terms of like this is not forever. So even if you get somewhere that you mightn't love or think you're going to love, I really encourage you to just give it your all and who knows. Yeah. No, it's not. It's yeah, it's very much it's based on your whole application. So we score it against a lot of different things. So what your referees say, your academic transcript, your clinical placement, and it's really we look at the whole package and then we assess them as a whole. And then once those offers come out and come back in, then they're prioritized based on those all of those factors. And then also broken down into what region you want to go to, what program is it, an enrolled nurse? Is it a registered nurse? Is it a midwife? So there's a few different things then, but it is competitive. So I definitely would like, yeah. Yeah. No, no, it's not so much where you do it. We look at the score and what your preceptors have said about you. So that's why we want to see that summative answer, and that tells us a lot. It tells you how you've went in previous years, and then we can see how you've progressed. I sometimes they don't really use your where you've done placements where to put you because that's the luck of the draw where you get your placement as well. So sometimes you'll hear stories of people because you've done an ED placement, that's how you get ED. That's not really the case. It's really because lots of people never got a placement in somewhere that they really wanted to, but that doesn't mean they don't want to be in that place anymore. And that's why the grad teams work to try and get you with your preference. Yeah, at least for one of your rotations. But no, just because you've done a placement somewhere does not guarantee you getting a place there. Yeah. Good. Anything else? Yeah. Totally, yeah. Noting that most people aren't finished when they apply, yeah. So just your unofficial is fine. You can apply with your unofficial transcript. So wherever you're up to, then it doesn't have to be your end academic transcript. You can just have whatever you're currently up to. You can No, you can apply now and just but submit your academic transcript as is. So even if you're missing the final semester, that's fine. So submit what you have. Yeah. Yeah. No. No. So what will happen is once you've got that conditional offer for a hospital, then the grad team will give you preferences and they will do their best. But if you, and I've just actually spoken to the grad educator just before I left about this, um, she'll say sometimes going, no, I'll not start in January because I want ED in April. And it doesn't work that way. Yeah, no. So it's not, you can say, can I start? You can have that conversation and please, I really encourage you to communicate with us. So like, don't, your friend's great, knows lots of things. They aren't the source of truth about this stuff. So you can preference and you can ask them, if I started later, do I have a better opportunity, and work with them together to have that conversation. Yeah. Naomi?
Expect to be getting the rotation that you haven't possibly thought of. Doesn't mean to say you're not going to learn, like Michelle said. You will all learn as a graduate year. You'll start here and you'll end up like that at the end of your first year. For myself, I got put in respiratory medicine in my graduate year, and I was like, oh my Lord, I think that's for me. I ended up loving it. I made so many great friends and colleagues that are still colleagues now, and I learned so much that I ended up going back there after my grad year twice because I really enjoyed it completely unexpectedly. So you just don't know. So even if you don't get your first preference, you're always going to learn in a supported environment. And I encourage you just to grasp those opportunities and run with them, because you will get the opportunity to move into other areas that you want to go in. But this foundation year is a really important, solid year just to really just grasp those opportunities and run with them. And it will be worthwhile, and it will set a good foundation for your future career.
Yeah. Yeah.
Can it be anywhere in anti-health or like in Palmerston or?
Yeah. So again, if it's all NT Health hospitals, so if you're open to going to somewhere fabulous, Alice, Catherine, Tennant, Gove, definitely put that down. And then with RDH and Palmerston, we put that as one. So again, that's a preferencing. So you'll be offered a place. If you do preference Royal Durham Palmerston, you say that's what you get a conditional offer for. And then again, it's that conversation with the graduate team in terms of preferencing those areas. But definitely the graduate education support, the clinical support, and the experience of going to some of those more smaller regional hospitals is fantastic. We work really closely with the grad educators in those teams and speak to grads who've been through that program. And again, so similar to Naomi said, so many of our leadership people, so many of our education people, so many of our management have come through the graduate program in all of these different places. And now they're senior people. They're the people who are deciding these things. It's such an opportunity. So if you are free and easy and able to try something else, I would strongly encourage you to look at that. And even what we started doing the last couple of years has been really good. If you want to speak to an educator down in Catherine or Alice before you even put in your application, if it's a little thought bubble that's thinking that could be really cool, and you just want to chat to them because they're so well placed to tell you not only about the program in these places, but life, what you do for fun, what you're into, and they're super, super happy to speak to anybody who's got a little inkling of an interest, whether that's moving by yourself, partner, family. These places have so much to offer as well. So definitely don't discount them just because you might be here or anyone online if you're interested in coming along. Like definitely just reach out and I can put you in contact with anyone to find out more information as well. Yeah. Oh yeah. Sorry. No, I see. Can I do this? Let me stop sharing. Oh, whoops, sorry. Oh, here. There we go. Hi, Hannah. Yes. So if you are still completing studies in semester 1, 2026, you will not be eligible for this year. But the applications for 2027 will open mid next year. And again, similar to this year, if you have registration, pop that in. And then if there's anything available towards the end of next year, you will be high priority for it. No worries. Yeah. Yeah, I was saying that as well. Yeah. Yeah. So again, that will be an ongoing conversation. So you'll be connected with your grad educator, you'll be connected with your line manager, your team leader, and they'll be checking in with you to see how you're going. And if it's something that you're really interested in, have that conversation early. Again, I can't over over explain how important it is for you to be professional this year. Have those conversations. This is the start of it. So it's those performance conversations. If you feel I really want to stay on here, ask those questions. What should I be doing? Is there any further educations available to me? What pathways do you think I should take? Have those conversations. Let them know that you're interested, and they'll probably feel it and see it and do those check-ins. But have those conversations with the people around you, and those people who might be more experienced on the ward that you're enjoying. What did you do? Was there anything else that I could be thinking about or doing, or upskilling in a different area? Is there anything available through NT Health that I could utilize? So all of those things, and just be engaged and look for those opportunities throughout the year as well. They'll probably find you, but seek them out too. Yeah. Anything else? Yeah. 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 What visa are you on? Student visa. So what will happen is you apply as soon as you're ready. We'll see that you're on a student visa. You can then you'll get a letter of completion when you're finished your studies. The university will give you a letter of completion. It's just a one pager to say you've completed this on this date. If you supply that to us, then we can say that overrides your student visa in terms of, you can only work 40 hours a fortnight. That letter overrides that. So you can actually then work full time, which is a caveat of the a program. And then so if you had this all in time, this is all going to plan, and you did get an offer and you were able to start in January, you could start in January, and then you're employed, and then you just need to give your new bridging visa or your graduate 485. You'd give that to the recruitment team, and then they would just note that you've got ongoing employment. Yeah, is that clear? Sorry? No. So, but and definitely you might have to wait for it to start work, but don't wait for it to apply. Yeah. So really, and that's a change we made a few years ago. So really, your visa that you're on in time of application doesn't impact ongoing. It might impact when you start, but definitely don't wait to apply because of your visa. Yeah. Yeah. Did you have another question? No, you're good. All right. Okay. Yeah. Mm-hmm. That will be dependent. So what you will get with a successful application is a conditional letter of offer that won't have any dates on it. That will be, do you want to accept a graduate program at Royal Darwin Hospital? When you say yes, then we put you in touch with the grad team and then they talk to you about preferences in terms of clinical areas and preferences for intakes. And that intake will be dependent on availability and when suits you. And that could be visa related. It could be the fact that that's full, but there's spaces here. Or again, that conversation, I really want a placement here. Is that available here? That's again, they're not guaranteed things, but they're conversations that you can have. Yeah. Yeah. Oh, sorry. Yeah. So what we do, we don't, if you, sorry, that's a really good point. When you're submitting your application, there's on the application forms, you can list 2 preferences for locations. I would really recommend if you're not interested in going somewhere, don't put it down. You can put Catherine, I only want to go to Catherine, and that's fine. That helps us make our decisions. We're not going, what are they basing this on? There's good laxa down there, I don't know. But no, if you only want one area, you've got family, you just don't want to move, whatever, don't put Alice Springs. If you did but a second place, we are not going to just say you need to go there because you put it. That will be a conversation. What we'll generally do if you put, say, Catherine as a second preference in Darwin, we'll contact you to say, well, actually, like, is that something that you're interested in? Because maybe you just thought about it, but you want to speak to a grad educator and you want more information. Or actually, Darwin doesn't have any availability till August, but Catherine has some earlier. I might be willing to do that. So it just is a conversation starter. But really, if you're not interested in going somewhere else and you've just got one location, please just put that one location. It stops us emailing you and asking you questions. That yeah, yeah, yeah.
Like, you know what, I'm going to try ICU and try ICU 6 months, 6 months, and you're prepared to relocate.
That's a conversation. So that's not a given. I mean, we've had some people do it, but it's a conversation with lots of different aspects. So obviously you at the centre as a grad, but then also the graduate teams in both areas, because it has to line up with people rotating in and out. It depends if it's all one way. So it's definitely something that can be a conversation, and it really depends on the area. But if it's something you really would like to consider, again, contact us and we can have that conversation. Yeah. Yeah. No, we don't interview. And again, this is very similar to all NT Health applications. We don't interview. And that's why we really put that emphasis on putting in that application as needed. That's you showing who you are. Yeah. So no interviews. Yeah. Yeah. Cool. Cool. Anything else? No. Cool. No problem. Thank you very much, everyone. Thank you. Thanks, everyone online.